will read the questions, and you've had them already anyway. First, do you see the lack of health care for healthcare workers, particularly direct care workers in long-term care, as a crisis? Along with that goes, do you believe that there is a link between this problem and the quality of care available to our community's elderly, disabled, and chronically ill members? The second question will be, the Maine Superintendent of Insurance is due to release a report on this situation with recommendations for action on October 1st. Will you agree to meet with us within 3 months of your election to discuss this report and work together to implement some of the action recommendations? And under the federal level, will you work to make sure it is supported with federal funds?
You said a simple yes or no?
Yes, please.
Yes, yes, yes.
I won't keep asking the question over because I want you to speak.
Do I see this as a crisis? Absolutely. I work in this field, and I have plenty of patients who I am struggling to find someone to come into their homes and help care for them. Their families cannot do it alone. And it's not a job people want to do. It's physically demanding. It's not like an office job where you might be able to surf the internet here and there every so often. You're physically in with the patient all day long. And some of these people have really bad chronic illnesses that require diligence and physical exertion. So it takes a lot out of you, not just emotionally, but physically as well. And if you don't have health care, it's the same we give our elderly couples. The one caring for the one that's disabled will eventually actually get ill, and if not, some of them actually die before the person they were caring for because of the stress that they've had. So yes, it's a dire situation, and healthcare for them is very, very important. I'd be happy to do that with you. Thank you.
Absolutely. This is a crisis for healthcare workers, and there's definitely a link between this and the quality of long-term care. I've been able to see this firsthand with my son's care. He receives 24/7 direct care services and has for the last 3.5 years, although I hasten to add that he's not on the state for those. But there's no question that he would not be able to benefit learning to live on his own, learning to be independent, to stand up on his own 2 feet without quality people there to assist him. And that it's, I can think of one service worker named E, I'll call him E, who had health issues. He was a wonderful man for my son, but wasn't able to be there as much as he could because of health issues, because he didn't have the insurance. There's no doubt that I would meet in 3 months in order to work with the group to promote these principles. I'm a pluralist. I have a lot of people with diverse viewpoints. It's the best way to approach complex problems, and I think that a program such as this with a diverse membership and nonpartisan politics and a nonprofit status is the way to go with complex problems. Thank you very much.
My answer is yes and yes. And your question is it a crisis? Of course it's a crisis. But in order to look at the crisis in its proper proportions, we have to get our arms around the larger problem. The caregivers and the care receivers, the people with insurance, the people that are uninsured. That really is the issue. Because the reimbursements that we've talked about from 1998 being adjusted for 2005, we're back to the age-old thing. It's about money. We have to make sure we spend the money wisely. And the problem is the affordability of health insurance and the insurance providers. We don't have a lot of options in Maine. We can do better. And I think the legislature can go a long way to address those issues. So yes, do the health care providers, the home care providers, he's wheelchair, he has monocular vision, he has glaucoma, and he needs care. The problem is in Maine, and as all of you may be aware, Maine is by demographics, Maine is the oldest state in the nation. And Waterville has the distinction of being the oldest city in the state. So Waterville is the oldest city in the nation, again, by demographics. Where do your health care needs come in the advanced years? Oh, did I miss the red card? I'm sorry. Thank you for your time.
I'm going to take a stab at reality here, okay, folks? Look, yes, and yes. But let's be realistic. It's about common fairness. People who work to keep us well should be able to stay well themselves. You know what it sounds like to me? It sounds like your bill, you were promised something. And what happened? It didn't quite get delivered, right? That's an act of promises I'm not going to make. You bring me a bill. If I tell you I'm going to support it, I'll support it. Okay? I'm not going to change my vote at the last second because the leadership came to me, told me that's the thing to do. You know, this whole thing about we don't have enough money. Let's get creative and make some more money then. If we don't have enough money in the state government to cover these kinds of programs, make more. Okay, I was talking with the gentleman over there at the table. Great idea for raising revenue. And did it not raise the equitableness of the situation? I explained to you how it increased the fairness of the situation and raise money for health care. I can't get into it in 90 seconds to explain it. We need creativity in state government. We need intelligence. Thank you.
Yes, and yes. We do have a crisis. I think that we have it in a couple of areas, but certainly this is difficult, especially since our population is aging. Young people can't afford to do these jobs. And I think that we have very uneven legislation about the qualifications for people in these jobs, and we clearly need better legislation. We need better health care. We need better prevention. And I would be eager to meet with you guys.
Well, I was here in 06, whatever it was, when 1687 came along. Thought it was a good idea then. Still think it is now, and I'll still go along with the 3 recommendations, of course. But I'm going to be the skunk at the wedding here for a minute. We're talking here today about the broad overall medical crisis in this country. Far greater minds than us and far people higher up the food chain than we are having these same discussions. What we're doing here today is the country are wrestling with the same issues, coming up with the same answers or lack of answers, and politicians are making all kinds of promises. Okay? I'm a little disappointed that KVO has changed its focus. I thought it was a good idea 2 years ago to take one aspect, make that their goal, and focus on that. Other people are focusing on the other issues. I think KVO should try to bring back a version of 1687 and put all their efforts into focusing on that.
It seems there's a lot of gas passed all the time about research to death, an issue that really should have some action to it. If we can afford to bail out banks to the tune of $1 trillion, I think we can come up with the money for a national health care plan. It seems absolutely insane to me, and it's just logic. There's no details. The details is after you make a leadership decision to go for it. And I'm going to try to get this. At just the end of World War II, when London was on its knees, within that 2 years after, they created a national health care plan. They still have it. They were completely decimated. Why can't we do that? All it is shifting priorities out of the pockets of the insurance companies. I repeat that. Decide we're going to do it and do it. They're going to bail out these insurance companies and banks, so let's do it. China owns us anyway. Where do you think they're getting the money for that? So I will stop. I know.
What was your answer? What was your answer?
Yes. Sorry about that.
Yes, there's a crisis. Yes, there's a link. And yes, I'd be happy to meet with KVO 3 months after the election if I win. God bless direct care workers, and God bless the volunteers, because a lot of them are underpaid, overworked, and a lot of it goes by. They're not even on the books, a lot of people that are working out there. They're not even getting their should I say measly $9, $10 an hour. They're not even getting anything, not even health insurance. So there's a lot of folks out there that are doing an awful lot of work for very little. I did want to mention, okay, because I mentioned my plan a little bit earlier, but I do think that we can do a state mandate, just like we do with auto insurance, okay, that's affordable, that everybody pays, and we can all be covered, and maybe I'll have some more time during the next round.